Last year, Congress passed a law that removed 12 years from Medicare's financial timeline. Not slowly, not in theory, 12 years gone, according to the nonpartisan Congressional Budget Office. And if lawmakers take no action before 2032, that same law automatically triggers a 24% reduction in Social Security benefits for every retired American. It does not matter how many years you contributed. It does not matter what your income is. None of that changes the math. The people who will feel this most are the ones receiving the least attention in Washington right now. There is one specific detail buried in this story that most reporting has overlooked. I want to walk you through it clearly. The figure that matters most here is not the 12 years. There is another number that more directly affects your household finances. I will get to it shortly. First, let me explain what actually took place. In July 2025, Congress passed a piece of legislation known as the One Big Beautiful Bill Act. The law reduced taxes and introduced a new deduction for Americans 65 and older on their Social Security income. On the surface, that appears to be a positive development. For many older Americans, it does lower their tax burden in the near term. But the law also did something else. It reduced the flow of revenue into the trust funds that finance Medicare and Social Security. Those programs rely partly on income taxes collected on Social Security benefits. When the new law reduced those taxes, the money going into the trust funds fell significantly. The Congressional Budget Office released updated projections in April 2026. Their findings showed that the Medicare Hospital Insurance Trust Fund, the fund responsible for covering hospital stays, skilled nursing facility care, hospice services, and home health care, is now expected to run dry by 2040. Just 1 year earlier, in March 2025, the CBO had projected that fund would remain solvent until 2052. 12 years of financial runway gone in under 12 months. Now, let me explain what losing those 12 years actually means for people on the ground. This is the part that deserves more attention than it is getting. When the Hospital Insurance Trust Fund reaches zero, federal law does not permit Medicare to borrow money. It does not allow the program to operate at a deficit. There is no flexibility built in. The law simply requires that Medicare pay out only what it collects in incoming revenue at that time, nothing beyond that. The CBO projects that when the fund is depleted in 2040, Medicare hospital payments will face an immediate 8% reduction. By 2060, that figure rises to 10%. 8% may not sound severe until you consider what Medicare Part A actually covers. Hospital admissions, emergency procedures, skilled nursing facility care following a serious illness, hospice services. These are not elective or supplemental benefits. They are the core services that older Americans depend on during the most difficult periods of their lives. And those services are now 14 years closer to an automatic funding cut than they were just 1 year ago. I mentioned there is a second number that carries even more weight than the 12 years. Here it is. The Social Security Trust Fund, which operates separately from Medicare, is facing a more immediate deadline. The CBO projects that the Social Security Retirement Trust Fund will be exhausted by 2032. That is 6 years away. When that fund reaches zero, federal law automatically triggers across-the-board benefit reductions for every retiree in the country. The Committee for a Responsible Federal Budget, a nonpartisan organization focused on fiscal policy, calculated what those reductions look like in actual dollar terms. For a typical couple retiring in 2032 or shortly thereafter, the automatic cut amounts to $18,400 per year in lost income. That is not a one-time adjustment. That is an annual reduction for the remainder of their retirement. For a retiree currently receiving $2,000 per month from Social Security, a 24% cut brings that monthly payment down to $1,520. That is $480 less every single month. That covers a utility bill, a car payment, a week of groceries. And under current law, that reduction takes effect automatically the moment the trust fund balance hits zero, unless Congress passes legislation to stop it. The One Big Beautiful Bill Act reduced trust fund revenue by an estimated $169 billion over 10 years. On top of that, the Social Security Fairness Act, a bipartisan bill passed earlier in 2025 that extended benefits to certain public sector workers, added another $200 billion to the projected shortfall over the same period, according to the Social Security Administration's own chief actuary. Combined, these two laws pushed Social Security's insolvency date nearly a full year forward and increased the size of the eventual benefit reduction. Here is the part of this story that most coverage fails to explain clearly. These cuts are not a future political decision. They are not subject to a vote in 2032. They are not a negotiation that will happen when the deadline arrives. They are written into law today. Current statute states that once the trust fund balance reaches zero, the Social Security Administration cannot legally pay out more than it receives in that month's incoming revenue. Congress does not need to vote to reduce your benefits. The reduction happens automatically unless Congress votes to prevent it. And the last time Congress passed meaningful legislation to stabilize Social Security was in 1983, more than 4 decades ago. So, what steps can you take with this information right now? To start, understand that this outcome is not fixed. Congress has tools available. Lawmakers could raise the payroll tax rate. They could lift or remove the cap on wages subject to Social Security taxes, which currently sits at $184,500 for 2026. They could redirect general federal revenue into the trust funds. They could adjust the benefit formula. Most likely, any real solution would involve a combination of these approaches. None of these options are easy politically, but all of them are available. The program has been stabilized before when lawmakers chose to act. The second thing to think about is your own retirement planning in light of these projections. If you are already receiving Social Security benefits, nothing is changing today. The trust fund still holds reserves and is projected to remain solvent through 2031. You have a window of time, but it is worth understanding that current projections assume no congressional action between now and that deadline. If you are between 55 and 65 and have not yet claimed Social Security, these timelines are directly relevant to your planning. Waiting longer to claim builds a higher base benefit, which gives you more of a buffer if a future percentage reduction does occur. A retiree receiving $2,000 per month loses $480 under a 24% cut. A retiree who delayed and receives $3,000 per month loses $720. The raw dollar difference is larger, but whether that trade-off makes sense depends on your full income picture. If you are younger and 2032 feels far off, consider what the Committee for a Responsible Federal Budget noted in their most recent report. The people most exposed to the consequences of inaction are not necessarily those retiring in 2032. They are the workers in their 50s and early 60s today, people who are building retirement plans around benefit amounts that existing law may not be able to sustain without intervention. There is one concrete action available to every person watching this, regardless of age or political affiliation. Reach out to your congressional representative and both of your senators. Let them know you understand the 2032 insolvency projection. Let them know you are aware that benefit cuts are triggered automatically under existing law. And let them know you expect them to be part of a real solution. The Capitol switchboard number is 202-224-3121. From there, you can be connected to any representative or senator's office by name or by state. The 12 years removed from Medicare's timeline cannot be recovered without legislation. The 24% Social Security reduction set to take effect in 2032 will not be avoided without legislation. This is not a question of political ideology. It is a question of math. And right now, the math is pointing in one direction. If this breakdown was useful to you, consider giving this video a like. It helps this information reach others who may be navigating the same questions about their retirement. If you want to follow along as these deadlines approach and Congress responds, subscribing to Senior Support USA keeps you in the loop. We focus on breaking down complex policy into clear, practical information. If someone in your life is approaching retirement or already relying on these benefits, share this with them. This is information worth passing on. Thank you for being here.